Welcome back to Talk to Your Health. I'm Dr. Derek DeSilva. For 20 years, the stress test has been the standard for diagnosing coronary artery disease. But more and more in the health community are coming to believe that the stress test isn't always reliable. A relatively new test is gaining popularity in the field because of its accuracy. It's called Coronary Artery CT Scan, or CCTA. Here to tell us about it, and if you might be a good candidate, is Dr. Warren Schwarz, Chief of Radiology at Associated Radiologists, which has locations in Bridgewater, Edison, and Warren. Also with us is Gary Scheinman of Bridgewater, who recently had the test. Gentlemen, thank you very much for being here.
Thank you for having us.
Well, Dr. Schwarz, let's start with you and ask the question very simply, what is coronary CTA?
This is probably the most exciting technology that's developed in my 30 years in radiology for the patient. It's a way of looking at the coronary arteries without putting in a catheter and actually visualizing not only the artery but the wall in the artery to find early development of plaque.
Now, Gary, you had this test done recently? How recently did you have it?
Correct, about 2 weeks ago.
Okay. Can you just go through with me what it was like to do this test and why you actually had the test done?
Well, my heart doctor, Dr. Leventhal, had suggested that I have a CTA scan due to the fact that my EKG had changed from the last visit, which is about 6 months ago. And for any patient or anybody who's been through an MRI or any type of similar type of scan, you know, it's a daunting task as a patient and quite a scary thing when you don't know what's going on inside you. And even more daunting is actually the test itself, what the anticipation of what's going to happen when you arrive at the radiology group.
Right, right.
So I arrived on a particular day and was taken in, and they wanted to get my heart rate down to below 60 beats per minute.
Right.
So I was put in a room for about 30 to 45 minutes just to relax and rest, listen to some music, at which time the nurse came in and collected me and took me to the particular room where the machine was. Right. And then the scan really only took no more than about 10 to 15 minutes, including a hookup to an IV, which I presume was for a dye. Right. And apart from just really, there was no discomfort, but just a warm feeling while the dye went into your body. Right. But that was a very quick, easy, easy type of thing to go through.
Right. And Dr. Schwarz, I mean, that's pretty much, this is something that I also really need to have done, which I'm going to come over and do with you. But is that pretty much it? You slow the heart, you drop the heart rate down by giving people some medication, you put an IV in. I mean, is that pretty much it?
I've had it done myself, and yes, it's a very easy examination. It's just a peripheral injection of intravenous contrast. It's like any other CAT scan that you have done, CT scan. The difference is that we do it with cardiac gating, so we basically stop the heart, not actually stop the heart, but visually stop the heart so we don't get any motion artifact. We're looking for blood vessels in the order of 2 to 3 millimeters in diameter, which is about 1/8 of an inch in diameter. And with the new techniques, the new technology, the 64-slice scanner, we're able to scan fast enough that we can actually see these very small blood vessels.
And I want to say this, and this is very important for the folks that are watching out there. You don't actually stop the heart, okay? They stop the heart on X-ray so that they can visualize it and look at it. And that's very important that people understand that. What about risk factors? Excuse me, what about symptoms? People that have heart disease, what symptoms do they typically get?
Well, people with heart disease can have symptoms of chest pain is the classic one, shortness of breath, usually shortness of breath with exercise. But a lot of people who have their first heart attack don't have any symptoms before. Over 50% of people who have heart attacks have no symptoms before the heart attack.
Right. So I guess the purpose of this test is to prevent the chest pain and prevent the episode of a heart attack, as you just mentioned. Those are the people that really should get this, because we have to then look at what are the risk factors, right? What are the risk factors for people to develop heart disease?
Absolutely. Most heart attacks are preventable by changes in diet, exercise, and the medication that are available now, the statin drugs, can prevent most heart attacks. So what we're trying to do is identify people who are at risk for having heart attacks before they have a heart attack.
Right. So the risk factors: diabetes, high blood pressure, high cholesterol, smoking, sedentary lifestyle, all of those things. And I guess and family history.
Family history.
People that have those risk factors are probably the best candidate for this test.
Absolutely.
All right. Gary, you said the only thing that you had was a change on your EKG, right?
Well, it was a change in EKG. I mean, I've been under Dr. Leventhal's care for most probably the past year and a half. I was first sent in there because of an EKG that was abnormal. And then after that, it was found out that I had high blood pressure, a slightly elevated blood pressure. And so when the EKG changed again, his suggestion obviously was really to get to the root that there were no problems.
Right.
And again, as a generally healthy guy that exercises and watches himself as far as eating, you never know how over the years whether anything's going on, any changes.
We have a video that you brought of how we look at this, Dr. Schwarz. Could you just talk through this as to what's going on here?
Yeah, this is not Gary's video, by the way. Gary has normal arteries.
Okay.
This is video of somebody who does not have normal arteries. And what you see in the white is the X-ray dye that we've injected. The bright white spots are actually calcified plaque in the wall of the artery. And up near the top of the screen, you can see a narrowing in the artery. This is a significant narrowing. This patient went on to have cardiac catheterization and a stent put in after we did this study.
And if you follow that line right around there, you can see right at the top, right towards the top of the screen right now. Is that where the stenosis of the blockage is?
Exactly.
Very good. Now, what about insurance? Does insurance pay for this, Dr. Schwarz?
Sometimes some insurance companies will pay for it, especially if somebody's had a failed or equivocal stress test.
Okay.
Medicare will pay for it, and the other insurance carriers will pay for it under certain circumstances. But a lot of the patients that we get are cash pay.
Okay. And again, you will work with people that have issues that insurance doesn't pay for, and you guys will work some programs out for them and do all of that. Very good. Well, gentlemen, I thank you very much for joining me. Gary, I'm glad your stuff worked out well.
Thanks.
It's good to see you, and know this guy from a long time ago, but anyway, we'll talk about that some other time. But thank you for being here. Dr. Schwarz, thank you for this great information and also for this wonderful new technology that you have.
Thank you.
Pleasure.